So mental health nursing is a really specialist discipline. We support people around their mental health needs to recover in a very meaningful way. So we would empower that person and we would work in a person-centred way. So we'd be very individualised. So we would support adults, young people, but also support people's family as well. As a team, we really are passionate about person-centred care and about bringing that recovery ethos through our mental health nursing. So we don't look through the lens of deficit, we look through the lens of strengths and ability.
Just to study mental health nursing here in UCD because I knew that the facilitators are really good in terms of academic, and then in terms of practical placement, they're really good in guiding all students to pursue what they really want to learn.
In year one, a student will learn foundations of mental health nursing. So we would cover all the basics and support the students around understanding the recovery model, understanding therapeutic relationship. And we also run clinical skills, all those basics so that when they go out onto placement, they've got a chance to have a practice at that.
The part of the day college I enjoy most is the play simulation. I love that because through that I learn a lot.
Practice placements for the student nurses is actually incredibly important. So they go out for clinical placement in stage 1 for 11 weeks. When we move into year 2 and 3, the students would be focusing a lot more on areas like psychology, so really honing in and developing their skills around medication. We would move that into the simulation lab. So we'd start to move on from foundational into more acute areas, and we'd start to look at specialist care groups, and the students would do a 16-week placement in year 2. And in stage 3, mental health nurses would do a 13-week placement. In 4th year, we'd start to look at therapeutic interventions, and we really support the students around developing their abilities to deliver therapeutic intervention skills. And after Christmas, then they begin their internship.
I love the place here because during summertime, I can just relax and sit down there during my break time. Just sit down near to the lake, you know. I love sitting down there in O'Brien's Science, where you can sit down and do some bits and pieces or do some review or even relax. Is absolutely amazing environment, and the people are really nice and friendly too. I love as well going down to lifelong learning, which is for me as a mature student is absolutely amazing that all the facilitators there are really friendly and accommodating.
So work opportunities for graduates are very varied and exciting actually. Some people might like to study further and do some of the postgraduate courses we have here in UCD, or some nurses move off into advanced nurse practitioner courses and really lead the way around advancing mental health nursing practice in Ireland. The nursing role has changed a lot over the last few years, and nurses are beginning to view themselves actually as leaders. And now when nurses identify a gap, they're actually able to fill that gap more themselves and actually create real change within a mental health service. These are the roles of, being a clinical nurse specialist and advanced nurse practitioner.